panel titled Elevating Our Impact, Exploring the Role of Professional Societies in Advancing Impactful Science to Shape Climate-Relevant Health Policy. My name is Kelvin Fong. I'm an assistant professor at the Department of Environmental and Occupational Health at the George Washington University, and I will be moderating the panel today. We have three very impressive speakers, panelists to join us today. The first is Dr. Yanela Nunez. She works at the Physicians, Scientists, and Engineers Healthy Energy nonprofit research institute that studies the way energy production and use impact public health and the environment. She holds a PhD in environmental sciences from Columbia University. Our second panelist is Dr. Mary Rice. She's the director of the Beth Israel Deaconess Medical Center Institute for Lung Health, which is a multidisciplinary respiratory research program in Boston, Massachusetts. She's also the associate professor of medicine, as well as a director of research. Last but not least, we have Dr. George Thurston. He's the director of the academic programming Exposure Assessment and Human Health Effects at the New York University School of Medicine. And he's a member of the executive committee of the US EPA's Board of Scientific Counselors. He's a leading scholar on the human health effects of particle air pollution, and he has conducted extensive research on health effects of air pollution around the globe. Welcome to all three panelists. Thank you so much for taking the time to do this for us. I have to say that we are hosting this also supported by the International Society for Environmental Epidemiology, North America Chapter Policy Committee. And today, how we'll run the session is we will pose a few questions to the panelists, and this will be a little bit of an informal discussion. And I welcome any of the participants to also send in any of their questions to the chat. And my goal is really to have some discussion about our topic develop organically. So the first question that I have for the panelists, and I invite Dr. Rice to start us off, is in the past few years, what activity did you participate in sticks out as especially impactful for climate and health policy?
Thank you, Kelvin, and thanks to all who are joining us today for what I hope will be a productive discussion about our experiences engaging in policy and translation. So I'm a physician, and for me, one of the impactful experiences over the last few years was providing testimony at different kinds of hearings. So a lot of this was through the American Thoracic Society, which is very engaged on air quality and climate policy, but not all of it. So I testified at a hearing about carbon regulation, which was quite some time ago, back in 2015. EPA a congressional hearing about EPA regulation, which was related and somewhat to climate policy, and one on the ozone standard. And in every case, what I would do is I would talk about the research, or the body of research, and then I would talk about what this meant for individual patients. And in some cases, I would give a story about one of my patients in a private manner, without revealing anything personal about the patient, but explaining, what this really means in human terms. And all of these hearings, I was kind of surprised. Oh, and another one I would mention, because it's different, not these like national level ones, but I also engaged in some local stuff, not through the American Thoracic Society, but just at my state house. My state of Massachusetts was looking at their grid and considering a transition to renewable energy. And in each one of these cases, when I looked at the other people who were testifying, they were mostly industry representatives, like people from Chamber of Commerce or the utility company. there were not a lot of doctors or scientists testifying at these hearings, and I really felt like these people were listening. Um, and and it really struck me how badly the medical voice is needed in these kinds of conversations. So when you talk about impact, I wouldn't say that any one of these hearings changed a policy, but I felt like it was impactful to engage in the discussion and to bring the science and the stories about what this means for patients into these discussions.
Dr. Thurston, I know this is an area that you have experience in as well. Do you have anything to add to that? What activity did you participate in over the past few years that you think has been especially impactful?
Yeah, thank you. Yeah, like Mary, I've provided testimony from different bodies. I would say one that stands out in my mind, working with an NGO, I was asked to testify and provide expert witness testimony about the health impacts of two natural gas pipelines that were going to pass through each of them through a historically Black community in Virginia. And I didn't oppose. I didn't say for or against the pipeline, but I just testified as to what the effects would be from the facilities they were going to install, and they were going to run engines to pump the natural gas through a pipeline out of West Virginia and towards a port. And just using this example, the first time, okay, in the first case, the state approved it anyway, and they didn't listen to me. But then it went to the courts, and it went in the state, and the judge looked at my testimony and reversed the decision and rejected the pipeline. And then in the second one, the state body that was reviewing these, I again testified, and I went in person, and actually that was very compelling for me to be there and interact with the community that was going to be adversely affected if this went through. Basically, this time, rather than have the courts overturn them, they rejected the pipeline right from the start. So, that's the kind of impact that experts can have by just getting the facts out and working with their professional organizations to give testimony, or with NGOs and groups like that. I've had a few other things over the years working. Again, American Thoracic Society has been very active. Lately, ISEE, we now have a committee that does a policy, and the recent setting of the PM 2.5 standard. Now, I do a lot of work with particulate matter, and back in the 1990s, I testified that we should have a standard before the Senate and the House. But we just recently got a call, mentioned to me that the OMB has to approve. Okay, EPA makes a proposal to modify the standard. In this case, they were looking to tighten the standard and make it more protective. But it then has to go to the Office of Management and Budget, and then the sort of financial people of the administration, have to say, yes, this makes sense financially. And I got the word that they wanted to know from here, not just from advocacy groups, okay, like the American Lung Association. They want to hear from the scientists who did the research. So as part of our committee that Calvin, you helped run, we had a meeting online with the OMB and laid out the facts, the scientific facts. And yes, this is called for, and this is appropriate, and the science, it's based on sound science. And thankfully, today is the day, coincidentally, that EPA standard going from 12 to 9, which is not quite what was proposed by the ISEE based on the science. Well, they had ISEE had said 8, as did American Thoracic Society, but still a major step. And as scientists and researchers, we can really make a difference when we take our research and translate it into policy.
Great, thank you for that, both Dr. Rice and Dr. Hurston. It seems like a lot of the work that we as individual can do is to look for these opportunities to provide testimony and basically getting the science out and becoming a more effective communicator. I was wondering, Dr. Nunez, if you also, speaking from the perspective of working at a nonprofit, if there is an activity that sticks out in your mind as being especially impactful for climate and health related policy.
Yes, thanks for the question, Calvin. And my answer is similar to what Mary and George mentioned, but it's slightly different. So it's also in the context of a hearing, but I was part of a PSC team that provided technical support to Los Jardines Institute and New Mexico Law Center while they were going through a rulemaking process in the city of Albuquerque. So Los Jardines Institute is a community-based organization, and the Law Center was representing them through this process of rulemaking. And the rule that they were proposing was to incorporate cumulative impacts and the permitting process that polluters need to file to get license to have their facilities. And this regulation will mean that when polluters are applying for a new permit or renewing their permit, they will be facing more stricter regulations in areas that are already disproportionately impacted by air pollution and that are of low socioeconomic status. And the way that the rulemaking process works in Albuquerque is like a court case, basically. You have the party that is proposing the new rulemaking and that new rule, and they need to show evidence of why that rule makes sense, why that rule should be implemented. And then you have the opposite party who are showing evidence of why that rule shouldn't be passed. So our role was to support Los Jardines with technical procedures. We help them identify who are those communities that are currently disproportionately impacted. Where are the communities that are of low socioeconomic status in Bernardillo County, which is where Albuquerque is located. We work with them to define what does it mean to be an overburdened community. And all of this information they use during the hearing process. So it was a very rewarding process to be able to work and creating these visuals, these maps for them, defining overburdened communities, and then see them use this information in the courtroom defending this regulation that they were proposing. It also was very enlightening in terms of the politics that go behind new environmental regulations, because all this hearing is presented to the Air Quality Control Board, and the Air Quality Control Board decides whether the regulation passes or not. And as we were preparing for the hearing, the city council basically proposed a vote to dismantle the Air Quality Control Board so that they couldn't that we couldn't have the hearing. So we were preparing for the hearing, and we were actually even sure whether it was going to happen because of all this drama that was going on with the city council. Then we were in the middle of the hearing, and they voted to dismantle the Air Quality Control Board and ordered us to stop the hearing because there was not going to be funding for it. And then the Air Quality Control Board sued the city council. So it was really a crazy story that it shows you also how much leverage polluters have in preventing some of those regulations to pass. But yeah, I think that last year this was one of the projects that I was involved in that I feel like I learned the most, and it was rewarding to be part of it, but also enlightening in terms of the politics of incorporating new environmental regulations. Yeah.
Thank you so much for sharing that wild story, and I guess follow up on that with you, Annalise. Do you think then, what role do you think a society such as ISEE or other professional societies could play, in supporting climate and health related advocacy and or research events that you might think in the future could make a difference or maybe may have supported you throughout this process?
Yeah, I think that this is a very important question, and I think that the answer is gonna vary by society, and like each society, I feel like they need to like decide what role they want to play. I think that something that I have learned through my my work in PSC and as I become more involved in the policy space is that the value and power of our position as scientists. It's very difficult to, it's very challenging to have your science seen as impartial and robust if you are viewed or presented as an advocate. So I feel like that can be like a difficult dance that we find ourselves in sometimes when we want or research and our scientific work to have an impact, but we want to continue to maintain like scientific credibility. And I think that when we're talking in the context of like scientific societies, yeah, I think I don't have like a specific question. I think it's a complicated question that is gonna have to be resolved. It's gonna be different from society to society. Some of the things that we have been doing in ISEE Policy Committee is to increase awareness to make sure that we're not just doing that research, but also communicating that research, communicating the findings of our research. And I think that that can be very valuable. Yeah.
Thank you. Dr. Thurston, I was wondering if you had any thoughts about the roles that professional societies should play.
Well, I think the professional societies have been just key in my own career of taking the research that I do and translating it into policy. I mean, it doesn't do any good to do research if it just sits on a shelf or nowadays sits on the internet somewhere that no one ever accesses it. So, you know, the belonging to the societies makes you aware and gives you opportunities. I mean, I would say that people, you know, when I advise students and early career people what to do, I say, get involved with your society, get on the committees. First of all, it's good for networking and getting to know what's out there, but also it enables you to really take the research, the science, and get it into policy and to explain it. Because if we don't do it, then the politicians are going to twist it to their the way they want it interpreted or misinterpreted. So we really have to stand up for science, and the professional societies give you that opportunity. They have the resources, some more than others, you know, but I mean, one of the reasons why, you know, I was, as Mary has been, I was chair of the Environmental Health Committee at the American Thoracic Society, and I rolled off of that. And that's when I decided, well, you know, we should have a committee like that at ISEE. So I got the North American chapter, the charter for that developed and passed, and then created this committee, which you guys are now running. And you know, I think we need to do more of that, obviously. And it was very effective in ATS, and I think in ISEE, people like yourself running that committee have been very influential in taking the science, and then also, you know, you get to, as I say, get network with other people, meet other people, and develop your career. So I think it's really important from your personal advancement as well as for society to get involved in these policy committees at the various. And of course, we're doing climate is another one. I talked about particulate matter. Some people will say, well, why are you talking about particulate matter when really we should be talking about climate? Well, you know, the sources of both are the same. And this, you know, we've been really unable to get real legislation through, some action to say, oh, here's climate is a problem, let's take action against that. But on the other hand, a lot of the public health things that we know about, if we move them forward and implemented, they have climate co-benefits. And certainly particulate matter is one. If we lower the pollution for particulate matter, we're also lowering at the same time carbon dioxide. And it's an indirect way of addressing the climate problem. So I really think those of us working in the public have to look at our work, our research, and say, well, if I advance that public health initiative and get that through, how can that also address climate? Because to tell you the truth, the other way around hasn't been working, of trying to get people to take actions for climate's sake. But we are more motivated and more able to get people to take action for human health sake.
Thank you. I'm cognizant that there's some questions rolling in, but before we get to those, I just want to give an opportunity for Mary to also address this question. I know you have had experience leading some of the policy committees within American Thoracic Society.
Thank you, Kelvin. I definitely have thoughts on this issue. So I was really struck, actually, that everyone on this panel, when asked what we thought was the most impactful thing that we've done in the policy translation space, we all talked about giving testimonies. And I know all of you have done other things, written commentaries, editorials, submitted, written documents to legal court cases. There's so much that each of you have done. And yet all of us talked about that moment when we were there translating the science to policy. And whether you call that advocacy or not, I think it's really an important role that we have as scientists, as experts, as clinicians, for those of us who are clinicians. And I think that professional societies are key to making that possible. We're all really busy and we don't know when these hearings are. What the American Thoracic Society has done really well, and part of that, frankly, is because they have more money, right? So I do want to point out, the ATS is not the only medical professional society out there. There are professional societies for every discipline of medicine, and I feel like that's an untapped resource that we should think about, because these professional societies often have boots on the ground in Washington, D.C., who have relationships with policymakers and with federal agencies. And so it was really through the American Thoracic Society that I had the opportunity really early in my career to start engaging in policy and giving those kinds of testimonies that I brought up at the beginning. The ISEE, I think, is really amazing because ISEE is not flush with cash, and yet think about how much this group of scientists has accomplished and how present we are both nationally, in Europe, around the world. So this year, for the first time, the ISEE sent a delegation to COP28. George and I were both part of that delegation, and it was really a learning experience for all of us, but also, I think, really powerful experience where we could talk about the science in a completely new setting, and discussions that were about city planning, where people were talking about well-being without talking about health. And so I think that's really a huge opportunity. I think for ISEE, one thing that a smaller society could do is try to fund representation from low and middle income countries whose voice is so badly needed at these discussions. So that's one thing that I would ask for.
Thank you for that. Actually, you brought that up. I know you have mentioned earlier in your responses that you have had interactions at the real local level, the federal level. I'm really curious to hear a little bit more about what your experience, Mary, was like at a COP28, if that really changed how you look at how societies and also you yourself could be contributing most effectively to influence climate and health policy.
Well, it was overwhelming. I mean, it's a huge, huge event. And as you may know, there's the decision-making that's happening centrally, but then there's all these side events. And every country has its own pavilion where you can meet the delegation from your country. And George so he should tell more, but he organized a workshop leading up a pre-COP workshop with NYU Abu Dhabi Institute. And so that was what brought many of us there before COP. And in anticipation, what we did is we put together a short document focused on the benefits of climate action. So rather than talk about the health effects of climate change, we identified 4 key benefits of efforts to mitigate climate change that are immediate and measurable. So clean air being one of them, healthier diet, transitioning away from meat-based food diet, sustainable energy sources so that communities around the world can have sustainable energy for healthcare facilities and for indoor heating and cooking, has many health benefits as well. And then the 4th one is clean, healthy cities, so sustainable transportation, active transport. So we had, and Yaneli helped make this beautiful infographic to go along with it. And so we went around and we talked to people with our little, we actually didn't have a 2-pager, we had a QR code, so it was easy for people to open. And we tried, and we focused on these really simple points. So it was, for me, a very different kind of experience. You know, I wasn't giving a fancy scientific talk. And yet, just like with those local testimonies, it really felt like, in many cases, we were bringing in new arguments, new points, new benefits to consider that weren't always part of the conversation.
Thank you. Before we move on from that topic, George, I wonder if you had anything to add in terms of attending COP and organizing this pre-COP workshop, if you have some experiences that you'd like to share from that.
Well, oh, thanks. Yes, well, I first actually went to COP 5 in 1999, and we were very optimistic. It was 1999. Al Gore was about to be president of the United States, the climate president, and that didn't work out. And that way, anyway. So it was, you know, going to these meetings and talking about health, and especially the health benefits of taking climate action. Over the years, every few years I would go, and you know, it was worthwhile, but it just we didn't have enough critical mass talking about it. So that's why one of the reasons why I formulated this idea of having a pre-meeting to get people in, to raise. Basically, I applied for funding and then supported travel for people to come in, and then they most of them stayed around for the next week, 10 days to participate in the COP meeting. So, you know, I wasn't lonely anymore. You know, it was, and also they had a coincidentally, really quite coincidentally, they decided to have a health day. So that really put the focus on health, and I hope it continues, and I hope that the various delegations will be still coming every year and raising that, not just this one time, because I really do think it's a major motivator. One of the questions I see in the chat had to do with what can NIH do to help advance, and of course NIH has limitations on you know, how involved they can get in policy and things. But I do think maybe NIH, you know, okay, how did we get involved with this OMB? I didn't know that OMB was looking for scientists to give them input, you know, and tell them, is this science really valid here? And you know, should we let this go through? But I heard about that from people in the American Lung Association. So then I brought it to the committee, and we sent, you know, we had myself and others call in and do that. So, but it's so hard to know, you know, it's all word of mouth. And who do you hear from? You can go, like EPA just had the lead document come out today, and they announced that they're having, I can't remember, some actions by SAB, but there's all sorts of things going on in the government that we just don't know about, where they could use science input. So maybe NIH, if they had a central place where the government is looking for environmental science input, you know, not saying what to say or anything, just to say, here's an opportunity. That could be a real resource to people like us who are, willing to participate, but we just don't, like you mentioned, we just don't know what are the critical moments when the government or some local body is looking for scientific input. And so if somebody were to gather that and put it in one place, then I think we could get more participation, and it would broaden the participation. I mean, okay, so who do these people go to if they're looking for someone? They go to the well. They ask the same people over and over again. And we're saying, no, we want new people to come in and do this. But if we had a place that people could go and say, oh, here's some opportunity where I could get involved in translating my science into policy, I think it would broaden the workload and involve more people and get a greater span of knowledge that the decision makers could hear from. So I don't know, that's one idea just comes off the top of my head for that maybe that would be within the purview of NIH to provide those kind of, a place for people, the scientists to go and look and see, well, what's happening.
Yaneli, I was curious to know, with your experience or perspective from working on a nonprofit, if you had similar thoughts, or if you had anything to add in terms of things that would make our jobs a little bit easier in terms of finding out about information. And it seems like a lot of what George has mentioned is just increasing awareness among scientists.
Yeah, I have a couple comments. So like in the context, I see a question in the chat that I think is relevant to this in terms of like how did we become involved with this like rulemaking process in New Mexico. And in our case, PSC has a community consulting center through which we provide technical support to community-based organizations. And that's how we initially met Los Jardines Institute. So we provide them with technical support for a smaller project that they were doing on their community. So that's how we met. And then later they reach out to us and share with us, like, we're involved in this rulemaking process. Can you like be part of our team and provide us with a technical scientific support? So that's how we became involved in that rulemaking. And I think that I see two recommendations that have been really helpful in my experience to have my research work be more impactful. And something that I often I feel like there is, aside from the politics, there is oftentimes a gap between like what it's needed in the policy space and what we as scientists produce. And I think that there is two things that we can do to like help close that gap. And like one of them, I will say to like have to develop relationship and collaborations with policymakers. And honestly, this doesn't have to be with like federal senators and representatives. It can be very much in the local level, like relationships and collaborations with local policymakers. And this is very useful because it will help you. It informs your research about what are ongoing policies, what are ongoing issues that are being discussed in your local jurisdictions, and what information do they need. Like what can you produce that can inform those policies and help them move forward. And it's very difficult for us scientists to know what is needed. And like having these collaborations can really be super helpful and like helping you shape your research in a way that you produce useful deliverables. And another recommendation that I have is also developing relationships and collaborations with community-based organizations. So as George was saying, like, we're busy, we don't know what's going on. It's difficult for us to keep up to date with everything that's happening. And oftentimes these community-based organizations are very active in the policy space. They have a policy agenda that they're pursuing for the year. They have like close relationships with policymakers, and working with them can also be very informative. they can share with you about, like information that is needed about topics that are being like discussed, and that it will be helpful to produce information about. And also, so like in many cases, I have had community-based organizations approach us with actually like a research question that you can like, even like take it on as part of one of your projects. Like you will have communities come and be like, there is this warehouse that is being open, that is going to be open on my community. What is going to be the impact that's going to have on air quality? So I feel like this partnerships outside like the scientific, like about the scientist area can be really helpful. This like cross collaborations with non-scientists can be very impactful and help us produce research that is more useful in the policy space.
Thank you, Yaneli. I'm actually going to go to a question. So it sounds like producing science and doing work that is more relevant and useful towards policy and policy making. It's certainly a step that we all can take. There's a question that in the chat about how we in the community can combat sort of the politicization of science. I was wondering if any of you have had to sort of face that or deal with that. I'll start with you, Mary. I know you've provided a few testimonies in the recent past.
Can you rephrase? I didn't quite hear.
Yes, the
politicization
question.
of science.
Yes.
Got it. Okay. Yes, I have had some experience with that in some of these more feisty congressional testimonies. I think at the end of the day, if you stick with the facts, with the science, you're in a safe space. And if you speak rationally and clearly, you will win the argument. But you got to keep making those points. So I can, I'd like to share, this isn't exactly about climate, but it's related. Some of you might recall during the prior administration, there was this push for a new role called transparency and regulatory science. And to kind of simplify the whole thing, it was basically an effort to make it really complicated for the US EPA to use scientific evidence in its rulemaking. There were lots of different criteria that had to be met before the EPA would be able to use a certain scientific study to set, say, the ambient air quality standard. And it was kind of a thinly veiled attempt in most of our opinions that this to make it just really hard to use the data to make evidence-based rules. And the scientific community pushed back really hard, and I think we actually I think it was really unprecedented how hard we pushed back, both from the ATS was engaged, ISEE was engaged, and I'm sure there were many other professional societies that weighed in on this. I was part of one hearing on this topic, and there was an attempt to say, oh, you guys are being secretive, what, because some of the rules would involve making all of the data publicly available, but without really providing clear funding for how that would be possible. And so I really felt like we actually won that argument. Like when we all came together and pushed back really, really hard, there were legal battles that were fought and won, and then ultimately the whole thing just was dropped. And so I think that it was a positive story of where we all came together and through editorials, through testimonies, through hearings, said this is not okay. And I felt like the voice of reason won out against the politicization of science. I see George is unmuted. He and I were very much working together on
Yes.
Yeah,
George,
well,
please.
the thing is, just to give credit where credit is due to, they ended up getting it through. I mean, we provided information. I mean, one of the main impetuses, this issue has been around since the 1990s. They've been trying to get access to research data so that they could manipulate it and undermine. You know, they tried to do that with the lead and effects on children research, and wherever they can get a hold of data, then they can, you know, manipulate it. They get their gunslinger statisticians to manipulate it. So they wanted to get their hands on research data, but a lot of it is private. So this is what Mary was talking about. We couldn't give it up because we promised not to reveal it, but so then it wouldn't be able to be used. But on the other hand, if they could get a hold of it, then they can abuse it and attack the scientists using their own data against them. And that bill was delayed by all of the resistance, but it went through before the end of the prior administration, and only because the Biden administration came, we actually had a lawsuit and which delayed it, that we participated in, and then it rolled over into the Biden administration and they plucked it out. But
it was a 4-year battle. It was because of all that pushback.
Yeah, that it delayed long enough so that the Biden administration could undo it. Now they have that bill, and really all they need is for the administration to switch back. And it's all ready to go right back in again. So get ready, Mary. If there's a change in administration, all of these things that were bad for science are going to be reintroduced. There's a lot at stake in elections. So anyway, so you know, we should share the credit a little bit with the administration that they saw the wisdom in not having that rule. I would have liked to have seen them propose an alternative rule that was more reasonable, and then have that in place so that there wouldn't be this empty space to go into. But that's another whole story. The battle it's not over, is what I'm saying. They've been trying to do this since the 1990s. It really started with secondhand smoke, and they wanted to undo secondhand smoke regulations by getting a hold of the data and trying to disprove or question the research there. So, you know, it is a constant battle, and we need everybody to get involved. I mean, you know, we as scientists, you know, we've been trained and we have these capabilities. You have a platform. It's just a shame for people not to use it. And I would say working with communities, it's really one of the most gratifying things you can do, because you're allowing them to get a seat at the table, and they really appreciate it.
It seems that this relates to one of the questions that just came in, talking about the importance of interdisciplinary collaborations with regards to effective climate-related policies, and how perhaps professional societies can help in facilitating or becoming more of a facilitator of interdisciplinary collaborations. The points that obviously through ISEE and ATS, it seems that we have physicians, medical professionals, and scientists in the sense of environmental epidemiologists, but also environmental health scientists talking to each other. I was wondering then, I guess, if one thing that we could pursue in the future then is to extend beyond that, thinking through perhaps reaching out to legal experts or law associations. Actually, so I would like to pose this question to Yaneli. I guess you work at a organization, I guess physicians, scientists, and engineers, but I wonder if you've also thought through about which other kinds of expertise is important in terms of strengthening climate and health policy.
Yeah, so PSC is a scientific organization, so it's all scientists, very different fields of science, but we are all scientists. However, we work very closely with non-scientists. Like, we invest a lot of time in developing relationships with policymakers. We also invest a lot of time in developing relationships with community-based organizations. Every single project that we take on has a policy partner and a community-based partner. And that's like part of the reason that we can develop this very like action-driven research projects. And it's very important in the policy space. Another thing that makes it a little bit easier in PSC to form those relationships is that there are a very valued part of our work. And in PSC, like a peer review paper is kind of like a secondary priority. And that, like, working on that space, you have that time to invest and like creating these relationships and like being able to shape your deliverables to whatever is needed. But then when you are working in a more academic space, like time becomes really like challenging, because there's like all this all this stuff that you have to do as an academic scientist, and limits your time to invest on creating these collaborations, or limits the time that you can invest on like producing these deliverables that are applicable outside the academic science space. But yeah, for us, we spend a lot of time, we invest a lot of time in forming these relationships. Yeah.
Thank you for that. I'm aware of that. We have around 10 minutes remaining. I want to definitely get to one question that I want to pose to each of you. I know that we have more questions coming in, but the one question that I want to pose to each of you is sort of a look forward. So what are you working towards? What are you working on now that excites you most about climate and health related research as well as policy? Why don't we start with you, Yaneli? I think you've leading into from your response just now, leading to something that I think you can talk a little bit about some of the projects that you're excited about.
Yeah, there is like one particular project that I'm really excited about. So this is in the central, in California, in the California Central Valley. And many of you probably know that most of the oil that is produced in California is generated in the Central Valley area. So this project is in collaboration with the community-based organization called Central California Environmental Justice Network, CCEGN. And the project is to screen for methane leaks from oil and gas wells and characterize the concentration of methane that are being emitted and the concentrations of potential toxic air pollutants. And this project, that research question for this project literally came out of the community. So there has been multiple projects that have been sponsored by the state of California, where they look in the air quality and like fence-like communities living and like next to oil and gas infrastructure. But they generally look in like general averages. What's the average, like concentration of various pollutants? And the community felt that they were really not capturing these episodic events of like when the infrastructures or the wells are leaking, that those events have not been properly capturing when you're averaging all the pollutants. Like when you're averaging the concentration of pollutants just like over time. So that's how we came out with this project, to specifically go and screen for leaks and specifically characterize the toxic air pollutants that are being emitted during those episodic leaks. And this is it's like a very relevant project, and it's going to be happening in parallel to a campaign that the community is leading to increase awareness of the impact the oil and gas wells have on fence-like communities. And all of this is happening ahead of the upcoming referendum on the setback rule, where Californians are going to be voting on November on whether to keep the setback rule, which says that oil and gas, there cannot be drilling of oil within a distance of 3,200 feet from a home, hospital, or a school. So it's I'm really excited about it because, you know, like it has the science part that we will be doing. It's going to be alongside this like communication campaign that the community is leading. And it has like a very, it's ahead of that referendum, which means that our information can, you know, like increase awareness of the community, can be impactful on how Californians vote on this upcoming referendum for the setback rule. So I think that's one of the projects that I am like really looking forward on this year.
Thank you, Annalie. We'll move next to George. If there are any exciting things that you're looking forward to, but also I know you've been checking the chat. If there are any questions in there that you also want to speak briefly on.
Well, just what exciting my working. I think I'm really excited about the fact that people are finally waking up to the fact that particulate matter, the particles are not all the same. And in fact, fossil fuel particles emitted by fossil fuel combustion are among the most toxic. And in policy, what we've been doing, everyone's been doing is, I mean, fine particles, it was much better than when I started. Everybody was just looking at total suspended particles, and we got it down to fine particles, which is the more toxic. But these particles are different. And people are recognizing that when we use the average effect estimates for particular, I know this is a little in the weeds, but people just use the total mass, and some of those particles are more toxic and some are less. And fossil fuels particles are way above average. So that when we look at policies to transition away from fossil fuels, we've been way underestimating the human health benefits of doing that. And people are waking up to this. I'm seeing more publications where people are looking at particles based on what their sources were, not just the weight of the particles. And I think policy people have got to start realizing that really when we're talking about transitioning away from fossil fuels, we're transitioning towards a healthier human population, a healthier humanity. And it's really going to make a huge difference in so many ways in people's health. Looking across, and Mary, a physician, can tell you all of the various ways that this particulate matter adversely affects the body and worsens just basically almost any disease you can think of and increases the risk of it. So that's really what I'm excited about, is finally people are waking up to the fact that that transitioning away from fossil fuels is not just for the climate, it's also for our health.
Mary, over to you.
So I'm excited about a research project that's been keeping me busy for years now. It's a clinical trial of air purifiers for patients with COPD, and I'm really passionate about it because I'm a lung doctor and I care for a lot of patients with COPD, and they're especially vulnerable to combustion-related pollution, as George was talking about, and they might also be susceptible to aeroallergens, which is another climate-related exposure that's especially relevant where I live. And for me, this has been a new experience, shifting from epidemiology, where I'm just looking at previously collected data in large cohort studies, and really venturing into implementation science. And leading up to this, there was a great session. If you missed it, and I didn't get to hear the end of it, but a great session on implementation science. And I think that's something we've touched on in this discussion here, is that's really where we need to move towards, right? We need to move towards solutions-oriented research, engaging with communities, engaging with other disciplines, with lawyers, with behavioral scientists, so we understand what works. And those are the kinds of research studies that are really going to translate into policies, and policies generally, like it could be a program, right? It doesn't have to be a national policy. And so I really encourage us all to think about ways that we can move the field forward towards solutions. And for professional societies like ISEE, that means also giving this place for those kinds of studies, because they're costly, they're complicated, they take a lot of time, they might not be, involving thousands of people, but the findings can be really informative and can lead to, larger scale work that can really help people breathe and be healthier.
Thank you for that. We have around 3 minutes left. I just want to thank all three panelists today for joining us and providing their sharing their experiences, but also looking at this challenge that we face from different lenses. I think several things came out from the chat. I know that one person mentioned that the Medical Society Consortium on Climate Change and Health, has a meeting this coming week, and which includes visits to congressional representatives, as well as with the EPA. So if you're in the area, this is something that might interest you. And of course, there's also some notes about how you can share your thoughts about this session on LinkedIn and on social media. Want to give each panelist perhaps 30 seconds to a minute for any parting thoughts to conclude the session. Why don't we start with you, Yaneli? Sorry to put you on the spot.
Yeah, it's okay. I was thinking, like as we having this conversation, that maybe something that could be useful to incorporate in one of our upcoming ISEE conference will be to have like a mixer with some policymakers and community-based organizations, just to provide a platform for scientists to meet policymakers and like form, like network with community-based organizations. Yeah, so that's one thought that came to me as we're like talking about this. Yeah.
Very, very good point. I can share with you that these are things that are in the works for the coming ISEE conference. I know that there's some symposia that were submitted on this very topic.
Yeah, that's great. Looking forward to that.
Well, looking forward to seeing you there for that. George, do you have anything to add?
Well, I could just say that the American Public Health Association and their annual meeting, they sometimes have done that in the past, where they've set up a place for the people who are at the annual meeting to then meet with the local. They set up, they contact the local communities and groups in that city, and then get interactions going. So they have done that. I think it's a good thing to emulate. No, I guess I would just say the big message is to get involved. If you're feeling frustrated, like we have all this research and nobody's listening, which I think we all agree. Your professional societies are the way to get involved, volunteer to be on. I know you don't have time. None of us have time, but make time. It's sort of like, why have a cake that you're building and not put the icing on it? This is the icing. This is really what makes it, it count. So, everybody, really, you've got this platform, use it, get involved, and, it'll be good for your professional career as well, because you're going to network with some of the nicest people you want to work with in the future, and write grants with, or maybe get a job opening. I mean, there's just a whole range of personal benefits, but more than that, it's really about getting the science and getting it involved in decision making.
Certainly agree with you, George. Mario, for you, final thoughts?
I couldn't agree more with what George just said. It's the most rewarding part of what I do, and I love being on panels with like-minded colleagues like each of you. There's so much great stuff in the chat. I hope we're saving this. Dr. Quinn had a couple of questions and suggestions that I just want to flag, one of which is the potential for CAFÉ to be a resource or clearinghouse for some of these opportunities for translation. I think that's an excellent idea. And there was also a question that she posed about what's the most effective way to influence policy, because we all talked about testimonies and less about the other stuff. I think we need it all, and there's different ways that each of us can get engaged. And I think we need more voices, and the more these same arguments are made through different forums, whether it's on Twitter, Facebook, newspaper editorials, commentaries in journals, legal briefings, and testimonies, it's all impactful and important. But thank you.
With that, I'd like to close the session. Thank you again for the event organizers. Thank you to our panelists. Thank you to our CAFÉ for giving us this space to have this panel. I hope you enjoy the rest of this last day of the conference, and we hope to connect with you through our professional societies. Thank you very much.
Thank you, everyone. Bye bye.
Thanks.
Thank you. Bye-bye.
Bye.